All right. Well, I know we have audience members trickling in, so I'll go ahead and get us started. Good afternoon, everyone. Thank you for joining us today. Before I turn things over to our fantastic speakers, please know we'll be setting aside some time at the end of today's discussion for audience questions. If you have a question for any of our speakers, please use the Q&A button to type your question into the box that appears at any time throughout the webinar. Please include your name and organization with your question so that we can identify you for our speakers. The chat button today will be reserved for the materials that we plan to share with you all. Now, I'd like to introduce Shay Vilchik, the moderator for today's event, Stoneleigh Fellow, Research Professor, and Founder and Director Emeritus of the Center for Juvenile Justice Reform at Georgetown University's McCourt School of Public Policy. Shay.
Mark, thank you very much. And thanks to everybody who signed up for today's webinar. We truly appreciate your interest in this body of work and the young people and their families with whom we are really targeting this effort to improve the outcomes as they experience multiple systems of care. I want to thank, in particular, the Stoneleigh Foundation and Georgetown University, the Center for Juvenile Justice Reform. It was Stoneleigh Foundation that sponsored my fellowship that led to the creation of this pilot program. And of course, the Center for Juvenile Justice Reform at Georgetown that agreed to host the fellowship that allowed us to go forward. And last but not least, I want to thank the folks on this call from Erie and Delaware County. They are the real heroes of this work in terms of stepping up about a year and a half to 2 years ago and indicating that they wanted to apply to be part of this project. While we're going to hear from 5 panelists from those 2 counties, as well as Meghan Ogle, and I'll be introducing them in a minute, you need to know that there are dozens and dozens and dozens of individuals who stand behind them, who have been engaged in this work and advancing this body of work to the point that we're going to be describing today. So truly a pleasure to be with you all and with them to describe this body of work to you. So if we can move to the next slide, I'll do some introductions. So our presenters today, there'll be 6 of them. Melanie Govan is the Supervisor of Staff Development at the Delco Juvenile Court and Probation Services Department. Judge Richard Lowe sits on the bench in Delco Court of Common Pleas, where he presides over both delinquency and dependency cases. Gina Manarelli Augustine is a mental health program specialist in Erie County in the Department of Human Services. Meg Ogle currently is a research analyst at the Pennsylvania Juvenile Court Judges Commission. When she started in this work, she was also a fellow at the Stoneleigh Foundation, taking on this work as part of her Emerging Leader Fellowship. Sherry Prater is Director of Student Services at Erie City Public Schools, and Gretchen Sidler is the Placement Administrator for Children and Youth Services, again at Delco DHS. They've been a wonderful group to work with over the last year and a half or so, and I'm delighted that we're going to be able to work with them in presenting today. So before I move forward, let me just give you a basic sense of how we've organized the webinar. So I'm going to lead off with a quick introduction and summary of what the Multi-Systems Integration Pilot Program is about, what we're trying to do, the research behind the population that we're looking at, and what we're hoping to achieve, and then how we have supported the work in Erie and Delco as they've engaged in this effort with us. Then we're going to move on to a panel discussion where we're going to be able to hear from the 5 panelists from the 2 counties about how this work has unfolded for them since its inception. So while I'm going to move pretty quickly through the beginning part, describing the program, the pilot program, the population, the research behind the population, we're going to post a link to a webinar that occurred about a year ago that went deeply into that research and was at the very beginning of this body of work. And so the counties were describing why they got engaged, what the initial development was looking like. And I was able to describe a lot of the research behind the work that we were undertaking. So I'm going to do a quick synopsis of that. You're going to have a link to that first webinar, which is that deeper treatment, and you'll be able to access that on your own time. So moving out of the research, I'll then engage the panelists in a question and answer part of the webinar. That's really talking about what this experience has been like thus far, how they've created their own approach in engaging in the work, some of the successes, some of the challenges, and you'll see we'll go into an in-depth exploration around that. As you can imagine, as this project is hosted at Georgetown, we created a very strong data component to the work. So after that panel discussion, we'll move into a presentation around what that data program looks like, both the data collection and analysis in which we're engaged, and you'll be able to learn more about that. So we're really trying to hit on the things that in the middle of this project, and we're about midstream, if you were a county, a state, an organization thinking about doing this type of work, what kind of information would be helpful to you in learning so you could advance the work in your own way in an effort to improve outcomes for the population of young people. And then we'll open it up for the Q&A. So as Mark indicated, you'll have the ability to post questions in the Q&A icon, and then we'll leave time at the very end in order to facilitate that. So Mark, let's move forward with the substantive presentation. So the goal of the program was to bring together Georgetown University's crossover youth practice model, which has had great success, focusing primarily on child welfare and juvenile justice, with tangential intersection with education and behavioral health, and the work around system of care, which really starts in the behavioral health world and then feeds into these other systems for kids who touch those other systems as well. Trying to strengthen the manner in which systems work together by bringing these two bodies of work together, which may have happened in places in a sort of happenstance manner, but we were going to do this intentionally. So through an enhanced multi-system set of policies and practices, our goal was to improve system level operation, and then also the outcomes that children are experiencing and their families in child welfare, in juvenile justice, in behavioral health, and in education. So when we started this effort, we had 4 equal partners sitting at the table together across those 4 domains. And the multi-systems integration pilot program was initially focused on children known to all 4 systems at the same time. Mark? So what was our process of engagement? We created a bit of a governance model, and we'll talk more about that during the course of the webinar. Leadership team, an implementation team, and work groups. Leadership team being consisting of core leaders of different systems within the county, relevant partners like a public defender, prosecutor, and other key leaders that would be important to have at your table talking about how to work better as a system or systems in supporting these kids. Implementation team went deeper within those domains to broaden. So for example, in Delaware County, implementation team is about 40 people across those systems and organizations. And then in doing the individual work and developing changes in practice and policy, understanding the way kids and families might navigate through systems, we formed work groups across multiple areas that would be short-lived and were intended to help us develop new policies and practices in each of the 2 counties. There also was a rubric developed by Cal State University in LA around what were the policy and practice domains that seemed to be most relevant for success in relation to improving outcomes for multi-system involved children. So we also used that rubric. We modified it a bit to have a stronger emphasis around behavioral health and education. But we used that early on to identify gaps that may exist in each of the 2 counties so they could really focus their work on filling those gaps and improving the way they did their work. We developed policy and practice protocols, information sharing, memorandum of understanding, making it very clear about what information could be shared about children and families and in what circumstances. And then also either utilizing current or revising information sharing consent forms so that families and young people who were signing releases allowing the sharing of information would do it in a knowing and fully informed manner. Full training support in terms of how both Erie and Delaware County train staff and partner organizations in doing the work. And then getting into the data, developing baseline and pre-pilot and pilot data collection and analysis methodology. And we're going to talk more about that as we move forward into the webinar. And then we supported, of course, the launch of the multi-systems integration pilot program, utilizing those protocols, the information sharing MOU, and the consent forms, whether new or slightly revised. Mark? This is the training TA that we offered, a very specific, personalized jurisdiction-specific assistance in areas that the two counties identified that they needed. We supported the ongoing work groups. We created an opportunity for regular virtual meetings. We've done a couple of on-site meetings in each jurisdiction and created an opportunity for sharing of information across the two jurisdictions. And then as requested, networking with crossover youth practice model or system of care sites. And then of course, through Meg, Dr. Ogle supporting the measurement of the impact of the pilot program, both at a system level and a population level. Mark? These are the rubric policy and practice domains. I'm going to leave this here for you as a resource. I think it's informative in terms of the kind of things that you should be looking at in terms of the infrastructure, the left-hand column here, as well as the type of operational issues in the right side column that you would be focusing on in doing the work. We had both counties fill out the rubric in terms of any gaps that they thought existed, kind of measuring themselves as to how strong they were in relation to each of these. And that's how we calibrated some of the work that we did with them in developing the protocols. Mark? A lot of times when we do this type of presentation, we hear from folks about, where do you find these youth? I mean, what are you talking about when you're saying four-system youth, multi-system youth? And so this slide, and I'm going to just cover it briefly here, kind of depicts the four areas or stages that you could find a multi-system youth. So behavioral health and education are constant at the bottom. And so if the youth are enrolled in school, if they're receiving behavioral health services, and those two things intersect with involvement in child welfare on a voluntary or preventive basis, while also being involved in juvenile justice as a diversion, that's one type of multi-system involvement. Going to the right at the top, child welfare adjudication, juvenile justice diversion, another form of multi-system integration or touching more than one system at the same time. Going to the bottom row, child welfare voluntary or preventive services with the juvenile justice adjudication, and then the bottom right, child welfare adjudication and juvenile justice adjudication. So if you put all four of these together, assuming far left you haven't been able to prevent system involvement, you can see the way a child's trajectory might be formed. It might start with minimal involvement in child welfare and juvenile justice, and then progress in the bottom right to full adjudication in both. What we found at Georgetown when we first started doing this work was that oftentimes the kids who are considered crossover or multi-system are at that stage in the bottom right box. They're adjudicated in both systems. There's crisis at hand. There's a placement issue. There's a runaway issue. And then when the systems come together to say, what do we need to do for this child? The design of our pilot program was to say, from prevention onward, the entire trajectory, let's figure out what we need to do to better serve these kids, even if it's minimal involvement in both systems or moving down the trajectory, that pathway all the way to dual adjudication. How do we come together as multiple systems, working together, assessing together, planning together, and managing together in an ongoing way to do this work better? Next slide. So the characteristics that we have of this population, these are some of the demographics. What we know about the multi-systems youth in research that's taken place across the country is an increased likelihood of being female, being a girl, an increased likelihood of being Black, a higher proportion of LGBTQ, GNCT, gender nonconforming youth, higher probability of crossing over from child welfare to juvenile justice, as opposed to juvenile justice to child welfare. But the truth of the matter is, every jurisdiction is different. At data point's a national data point, but some jurisdictions, there might be first exposure to juvenile justice and then exposure to child welfare after that. It's just a matter of what happens in a particular jurisdiction. But these are national data points. Next slide. Across four domains, child welfare involvement, psychosocial, education, and juvenile justice, these are some of the outcomes we see for multi-systems youth. And this is compared to non-multi-systems youth who are system involved. I'm not going to go through every one of them. A lot of this material I wanted to put into the slideshow so you would have it as a resource, because you will also get a link to this PowerPoint presentation, so you'll have it available to you. But in every one of these domains, child welfare, education, juvenile justice, psychosocial, we're seeing worse outcomes in these domains than we do for kids who are non-multi-system involved. Okay, next slide. And let's keep moving. So what are some of the outcomes for the crossover youth practice model or systems of care that we see when we do this work in a different way? First, reductions on the juvenile justice side in recidivism in the justice system, reductions in new sustained petitions on the juvenile justice side, a reduction in pre-adjudication detention, and a reduction in the use of APPLA, Alternative Planned Permanent Living Arrangement, which means that the permanency goal would not be reunification or guardianship or adoption. It would be, there's an alternative that we're going to be looking at. Oftentimes that might be moving into independent living and not necessarily having a permanent home. And the other side of this equation increases. What we see with the crossover work is increases in educational outcomes, pro-social activities, improvements in behavioral health, an increase in the use of diversion, where oftentimes we don't see diversion used as often for multi-systems or crossover youth, an increase in home placement and reunification, as well as key social supports for adolescents that we want for all of our kids. And in the University of Nebraska study out of Omaha, they found significant jurisdictional cost savings when you do the work in this manner, because you're more effective in getting to those better outcomes more quickly. Next slide. This slide focuses on the system of care implementation outcomes. So remember, we're bringing these two bodies of work together, the crossover work and the system of care work. And these are some of the things that we see on the youth level, family level, and service level. And again, I'm leaving this material for you as a resource when you see when you get the full slideshow, but I want to move quickly through it so we can get to the panelists and talk more about their experiences with the work. Next slide. Okay. I think we're ready to move on to the panel at this point. So, we're sitting here, and I'm going to bring our panelists in. We're sitting here a little over a year, folks, since our first webinar highlighting the MSI pilot program, and at the very early stages of the launch of your new protocols, information sharing agreements, and any revisions you may have done to your consent forms. So it seems appropriate to reflect with you on the MSI journey thus far. So first I want to know, can you share a few of the most important reasons why you decided to move forward with this work? Well, I know the actual decision may have been at a higher level for some of you to apply to participate in the pilot program. The fact of the matter is that you all have been at the table helping to formulate a plan for each of your respective counties. So why was it important to do so? What did you hope to achieve? And I'm going to give every one of the 5 panelists an opportunity to briefly describe that, and I'll start with Judge Lowe.
Thank you, Shay. My reason was pretty simple. Just thought it would increase cooperation and exchange of information if we got better at this.
Thanks, Judge. I'm going to turn next to, we'll keep with Delco for right now. Turn next to Melanie and Gretchen. Melanie?
Obviously, agreeing with Judge Lowe said, we had some goals that we set out in the beginning here to achieve. One of the big things we wanted to do was sustain family connections and keep children living in their safe family settings. A key part of this going in was, for years, the systems have talked with each other about looking at these cases, developing a really strong process. So when I believe that when the leaders, reached out and applied for this, part of the attraction was we will have an organizer, we'll have a leader, we'll have Stoneleigh to hold us accountable to ensure that we meet the milestones that we're expressing we want to meet. So I know that that was definitely a goal or a desirable piece of this for us.
Great. Gretchen?
Sure. I know from the child welfare standpoint, we really acknowledge that some of these youth that we're talking about in these cross systems are some of our most complex youth. And I think we had a huge investment in really trying to intervene early and to get these children and families involved in a process prior to it getting so complex, and in doing so, increasing the family and youth voice. And really coming up with strong plans and coordinated case management across the whole child serving systems.
Great, thank you. Gina, let's turn to Erie.
Hello. I would say, definitely, as Gretchen said, we have a lot of complex cases where kids are involved with juvenile justice and mental health, and their families, and they're in placement, and their families are saying, they don't want them to come home. And like you said, Shay, those kids that are going to go into independent living, or maybe there's not independent living available. So we felt, we owed it to our families to do this and to try to better engage them, and also to just have that shared case responsibility, and not having one person do all the heavy lifting on especially these complex cases. So those are definitely our main reasons, I think.
Great, thank you. Sherry?
For the district, we were really looking at trying to improve positive educational outcomes for those students who are involved in multiple systems, because we clearly understood that the outcome of their ability to be able to have a career and move through life in a healthy, meaningful way with opportunities to have a career was significantly impacted if we didn't, because many of them, even though we're aware of all of these other systems, we don't necessarily work in tandem to help support those complex cases that Gina was speaking about to improve the outcomes for students. Oftentimes, as much as we wanted to, we were restricted or limited in how we were able to support those students in the building. And it comes back, hopefully, when they're coming back into the school setting, that they are functioning at a much better, and in a much better space.
It's interesting. I think what I'm hearing you say is that in some ways you were being impacted by, but didn't necessarily have as meaningful a seat at the table to impact on the educational side what was happening with these young people. Does that sound right?
Exactly.
Thank you all. I'm sure the people in the audience would like to learn more about how you organize yourselves to advance the work. While the center at Georgetown presented what we call a governance structure for you to consider, I'd like you to share what it looked like for each of your counties and how well it worked. So I'm going to go in a different order this time and turn to Gina first and talk about how you all organize yourselves in terms of the structure. I talked earlier about the leadership team, implementation team, and work groups. How do you all in Erie organize yourselves?
We really relied on our leadership group, our director of DHS, our director of OCY and probation, and Sherry from the school district, and Richard Gold, who was our legal consultant. Richard was really the lead on getting the MOU and the protocol developed. He really did a lot of that work. We have, certainly our judge is supportive of the program, but we have had a staffing shortage with our judges. We had some retirements, and so Judge Connolly was not always able to be at all of our meetings, but leadership supported us, and the work groups, the mapping work group, and Shelby Carnes, our data person, really came through for us with working with Doug in probation and getting all of that pre-pilot data.
But really creating a direct relationship between the work groups and the leadership team.
Yes.
Rather than necessarily maintaining the implementation team work better for Erie.
Mm-hmm.
Great.
Definitely.
Great. So Melanie and Gretchen, you want to talk about this a little bit from Delco's side?
Sure. We did have the three-tiered structure. So we had our leadership team. That was the director of juvenile court probation services and CYS. We had two leaders from the county's Department of Human Services. Judge Lowe was on the leadership team, as well as the family court liaison team. Juvenile district attorney, juvenile PD, the Delaware County head DA, and then the juvenile PD's chief social worker. So that was the leadership team. And then there was the second tier was the implementation team. And as Shay mentioned earlier, that was about 40 people. And those were representatives from schools, behavioral health providers, behavioral health support providers. We had CASA workers, we had guardian ad litem's, police were involved, probation, CYS, county office of mental health for the county, judges, public defender's office, and DA's office. So about 40 of those people, a lot of them behavioral health providers. We have a large county. There are many providers. So our office of mental health tried to pull in someone from each of the base units. The work groups, then we had several work groups. They were made up of about 8 to 12 members each. There was representation from each of the 4 systems on each work group. These people were pulled from the implementation team mostly. We had the mapping work group. They identified the process for each system and the different ways a case can work through the process. We had the MOU work group, that actually included the solicitors for CYS and JPO, so that they talked about legal stuff. So we let them do their thing, and they developed the memo of understanding and the universal release. We had a prevention work group work on identifying prevention services in Delaware County, and then considering what services we might be lacking in terms of prevention work in Delaware County. We had a data collection work group, pre-pilot data, and then post-pilot data. And then we also had the protocol work group, developed the protocol. So in writing, we had our group, we sat down and we put the pen to paper to come up with the specific protocols of what will happen with these types of cases in our county. And then finally, we had a training work group. So I believe the 3-level approach, I understand from our leaders, was really selected because the diversity of the implementation team was important. Specifically, I believe our leaders hoped that having a variety of the child serving systems, providers, and advocates intimately involved in the project would guide the development of realistic protocols, a smooth transition once we implemented the protocols, and then a forum for feedback from a lot of different people in the work and watching it unfold. So the implementation team met monthly via Zoom, which was great because even if a member of the implementation team wasn't on a work group, they were still receiving the updates and understanding where each work group was moving. So feedback was solicited at those times. I really think that our 2 site visits were really great opportunities when Shay and Meg came down and the implementation team was able to get together. And at that point, we were able to share ideas with each other in person, do activities together. And we literally went through the protocols line by line. And there was a lot of feedback that helped the protocol group adjust the final version of the protocols from all of the feedback from the implementation team. So the goal, I guess, was for anyone in Delaware County who touches these types of cases to have been involved, have someone in their agency have been involved in the development of it.
Melanie, we didn't start the protocols from scratch. Can you talk about the history a little bit, please?
I can. Shay, is that I think that
please.
we move to that next. Okay.
Sure, go ahead.
So, luckily, we were at an advantage here, maybe in Delaware County, because we had an SCR procedure already in place, defining how CYS and probation would work together when children were involved with both systems. So we already had a procedure in place for that. The systems of care also existed, which, everyone understands that collaboration among systems is important, and ensuring that families have all the resources available to them be known. We had both of those practices operating. So when this project came, we were at an advantage because I felt like we could just pull the 2 of them together to create the multi-systems integration protocols. So I can talk more specifics about the difference between the kind of the old way and the new way, if we're ready to move into that.
Yeah, I mean, we can jump there, but I want to just, for the audience's purposes, when you say SCR, under
Yes.
Pennsylvania law,
Great.
you could develop a shared case responsibility agreement and kind of codify that locally, that laid out how you would handle cases that were involved in more than one system, specifically child welfare and juvenile justice. Is that right?
That's correct.
Yeah.
I just wanted to jump in quick, Shay, too, to say with the work groups, I think we're all really, really busy. And so I just wanted to clarify that the work group, there was a huge amount of accountability to the work groups. So there were leaders to each work group. It was helpful to have Stoneleigh available to kind of push us, see where we were in our processes, and then to need to be ready at these monthly meetings to basically say, where is each group with what they're doing, and are things moving along, and if not, why, and where are the barriers. So I just wanted to, I think that's a huge piece of moving things forward.
Judge Lowe, would you add anything else on the governance question about how you all structured yourselves, and how did that work for you as the lead judge in the county for this work?
I thought there were a lot of people who were very energized to do this. And without them, we wouldn't have gotten this far, namely Melanie and Gretchen for starters. But I also think that having Stoneleigh with the regular meetings, Shay, you and Meg were very helpful. I think others might be able to pull this off without having an outside facilitator, but there were enough bumps in the road and tough issues that if we didn't have an outside facilitator, I'm sure it would have taken us much longer and a much less chance of success.
I appreciate that, Judge. I felt sometimes like Meg and I were just like in the sidecar, and we were just trying to keep up with you guys. Same thing for Erie County, right? We're just a sidecar. You both have done incredible work. This is, and to Gretchen's point, it's not easy to advance this, and which is why this particular webinar, the second one of 3, is so important for the audience to understand how exactly did you make this work? Because my imagining that we have people in the audience who are going, my plate's full. So how did you actually take on this additional piece of work and make it happen? And I'm hoping that we're shining a light on some of those things. Before we actually get into all the protocols, I want to go back to another part in terms of the I'll call it the work group piece. Could you talk about, and I think Gina, you mentioned Shelby Carnes. Could you talk a little bit more about how you handle the data side of the multi-systems integration undertaking and how it operated? Our experience is when you go into a county, you don't necessarily have an existing data work group across systems that's in operation, that's making things happen on a day-to-day basis with data. That particularly when you're asking for a cross-cutting work group involving juvenile justice, child welfare, behavioral health, education, sometimes there are stronger components than others. So I'd like you to talk about this, because I think you both handled this really, really well, and probably for different reasons. You got to this endpoint, I think, in being strong on this issue, but kind of a different path. So Gina, I'm going to go back to you, since you mentioned Shelby, and how you organized the work, I think in a sense really around Shelby and around some of the existing data platforms that you had.
I actually, I was not a part of this project. I was in a different position when we first received the grant. So I did reach out to Shelby and to ask him about that. And I'm just going to tell you what he shared with me, that the work groups were established and leaders were chosen during the first site visit, he said, and that was in April of 2022. And the data work group had regular video calls with representation from behavioral health, Office of Children and Youth, juvenile probation, and the education systems, as well as representations from Georgetown. And the calls were set up to have the group come to a consensus on what data they were able to collect and work through the regulatory aspects of data sharing in our county and between systems, and then develop and implement the process for data collection and sharing and compilation. And Shelby did the majority of that work with Doug from juvenile probation for the pre-pilot data.
Yeah, and what I can add to that, Gene, I appreciate you kind of channeling Shelby for our purposes today, which is great. Yeah. But Shelby's great. Is that you also had a unique data sharing platform in Erie County that allowed you to access information across systems that we don't see that in many counties. I think that really helped that data work group when Meg and I were asking for certain data points on the baseline data or the pre-pilot data, and Meg will talk more about that during the data portion of the webinar. It was easier for you all, I think, to retrieve a lot of that information. It's not simple, but easier.
Right.
So let me turn to Delco and this part of it for you all, because I know Keisha's not on the call. Keisha Brown was the chair of the data work group. But any comment at all, Gretchen or Melanie, about how that work unfolded for you? Because I think that really was, in some ways, forming a group that didn't exist before, and then out of whole cloth, creating a data plan and making it work. I don't know if you want to expound on that at all.
I think I can say that JPO had very accessible data, and that child welfare struggled with some of those data points. So I know it was it took us a little bit more to pull those pieces together. But hopefully moving forward, we'll be able to extract that and be able to see, better where our where we're going, where we came from, where we went from. But that was definitely a bump in the road for us.
I appreciate it, Gretchen. But the fact of the matter is, and folks on the webinar will see it later, you've all done a really, really good job in helping to cull together the data. And I think my lesson learned, not just from your two sites, but elsewhere, is that it takes a point person who says, I'm committed to make this work. I'll make sure we pull the data together. And I think Keisha did that in Delaware County, and Shelby did it in Erie County as the work has moved forward, and that's appreciated. Okay.
Jay, can I just add something there?
Sure.
Following up on Gretchen's point that it was easier for the probation staff to pull together numbers, I think that was largely due to all the data collection from the JCJC, which is the Pennsylvania Juvenile Court Judges Commission. They do a superb job of gathering documentation, of gathering data, and our juvenile probation feeds data to them. So it was easy to pull that data out when necessary.
Great. Thank you, Judge. Okay, so I know you started getting into the protocol discussion and diverted us over to data. So I want to bring us back to that and ask you just to spend a few minutes talking about what you would identify as being the primary benefits of developing the new protocols in the information sharing agreements. So Melanie, you mentioned the fact that you had the shared case responsibility agreement and you had system of care being launched in the county. So building upon that, you talked about how you brought it together, but now speak to what the benefits have been of making that move to bring them together as you see it for Delaware County. And then Gina, I'll turn to you after that to talk about those benefits as you see them, as the leadership team sees them for Erie County. So Melanie and Gretchen, why don't you launch at this? Then I'll turn to Judge Love.
We had broken down, I'm sorry, Mark, I didn't know if there was a slide coming for that, so I stopped.
There should be a slide coming. We should be skipping the next two slides. I'm going to come back to those later.
Oh, okay.
Then come on to this one.
Okay, so we had, when we really thought about this, we had identified what we saw as long-term benefits to the child and the family. So this was as we were developing everything. Now, or as after we developed the protocols, as we're moving into using the protocols, we're passing our adjustment period. I think folks are becoming comfortable with the model, and we're starting to see these benefits really come through now that we identified early on as hopefully the long-term benefits. So for the child and the family, you can go to the next slide, Mark. There are several benefits across the board. So as I had pictures up here, but I think you could probably look at them and determine what each is, but I'm going to walk us all through it. The top left is kind of obviously team. So the family now feels as though they're supported by a team of people, not just one person giving them direction, another person giving different direction, a third person pulling them the other way. Hopefully the benefit to the family is that they feel they're part of a team because our protocols have built them in, and we'll talk a little bit about those. But the family is invited to these monthly team meetings where goals are established and worked towards. So the second, they have the calendar there in the middle. The family shouldn't have to be attending multiple appointments for the same exact thing in terms of services. Easy example, children youth services is involved with a client, probation is involved with a client. Both workers see signs of mental health needs. Both workers schedule psychological evaluations and send the families to different places within a month to get evaluations. So moving forward, the protocols have put us all on the same page so that we all know what's happening in the other systems, and only one of us needs to get an evaluation. Repetition for the family, repetition. They need to understand that they are seeing the same people, they are hearing the same messages over and over again. No one's changing it up on them in the middle. They should know what to expect when they're working with their team. Bottom left, again, consistency, consistent messages from workers. I think we've all experienced a probation officer, a mental health provider, and a CYS worker, and then maybe a guidance counselor, all not maliciously, but all giving different messages to the family, maybe saying, oh, talk to your PO about that. I can't help you with that. While the other person is saying, talk to your CYS worker. I can't help you with that. So now it's consistency. We're all delivering the same messages and we're all on the same page. Empowering the family is important. The child and the family have a voice. Part of our protocols is having monthly meetings with the juveniles team. So the parent and child are invited to those, and they're weighing in on what are their needs, what are their protective factors, what are their goals, what are their next steps. Trust, we hope that the children and the families start to see that this is a team that you can trust. And sometimes the kids have a good relationship with one worker and not a great relationship with another worker. Sometimes they're working really well with their therapist, but they're still a little suspect of their PO. But when they see these people come together and they see that one of the people they trust is also bringing in these other folks and trusting them, it may help the child and family develop a trust for the whole team. And then overall support. The family should feel supported wholly by one team, and again, not being pulled in different directions. We really want the child and the family to feel as though we all are working towards the same goals, and those goals happen to be developed in part by the family. So you can go to the next slide. So then we talked about what could the benefits be, not to be selfish, but there are some benefits here for the actual people doing the work. The professionals also will have some benefits into their functioning. Top left talks about resources. Knowing what other systems have to offer is huge. If you have more resources, you have more problem-solving abilities, more confidence, more contacts. So knowing about another system's resources is fantastic. Also having the support of other people. Being part of a team who is working with a child and family, and everyone, see in the middle there, is holding a letter. So everyone has a part. And not one person, as someone had mentioned earlier, not one person is standing there holding all of the issues all by themselves. Because if we have to, as workers, hold the issues all by ourselves and try to solve them all by ourselves, we turn into the picture below, which is, burnout, I'm alone, I can't do this by myself. So the good news with the protocols is the child and family have a team, and the team is all of their workers. The light bulb represents the bright ideas. We all bring different perspectives into situations, different ideas for problem solving, because we have different resources and have experienced different paths in our system. Efficiency, same point as I made earlier. Child needs an evaluation of some sort. No need for all of us to be scheduling that evaluation. Each person has a task, and it avoids the duplication and the wasting of time. So overall, those are the benefits we saw long-term. And now that we're getting into the project, it's starting to show that these are the things that will benefit families and system workers as the protocols move on.
Great. Thank you, Melanie. That's really an excellent overview of where you came into it and how you believe it's starting to unfold. And we'll dig deeper on that in a few minutes. But Judge, do you have a comment about those expectations and how you think they're being realized at this point in some of the areas that Melanie and Gretchen have covered?
Yeah, thank you. I think there are kind of two buckets here. One is the easier cases, and one is the other is the harder cases. For the easier cases, I definitely agree with what Melanie is saying, and they're all very laudable goals. And I do see that in the run-of-the-mill case, that now more people are involved, namely juvenile justice, welfare, and likely the schools, that we're going to get more, and mental health, we're going to get better results for the kids. Having everybody in one room at one time just really helps deal with this problem. I can't talk to you, I'm on a webinar. I know that. Thank you.
Life of a judge.
That was a colleague who just won retention, so he's very excited.
Okay.
Generally, it's much easier on the judge to have everybody in one place at one time to find if there is a problem, assign it to somebody, or to find out who's already doing it, to find out what the plan is. They have their monthly meetings. They're tasked with having action items at the end of each meeting. So that gives us a judge real comfort that things are moving in the right direction. In the tougher cases, it's not so easy. This is not a panacea, and we all live in a world where there are a lot fewer beds in either child welfare or delinquency than there should be. So I have learned something through this process about human nature, which is when it really gets tough and everyone's frustrated, it's very easy to assume that it should be somebody else's problem and they're not doing enough to get it done. And that's just the way we're all built. And I need to sort through that to figure out what to do. Compounding that problem. So what that means is in a tough case where there's no bed available for a tough kid, that people are coming in and pointing fingers at one another. What I need to do is sort out what, if anything, we can do. Try to lower the temperature without, in terms of the blame game, and figure out who's supposed to do what so we don't have confusion. What makes that tough sometimes is that there are some issues that overlap between child welfare and juvenile justice. The simplest one being school. If the kid's having trouble getting to school, participating in school, and I want someone to follow up, it's not so easy for me to figure out who should be doing that, whether it should be juvenile justice, the probation officer, or the caseworker from CYS in conjunction with the school, of course. So you really need to have a detailed understanding as judge of who's responsible for what and what their mandates are, and the purpose for each of the two different organizations, child welfare and juvenile justice, if you want to cut through some of the problems that can develop in the toughest cases. One benefit I've seen for myself, I picked up on the spirit of the cooperation, and I noticed that in some cases I had meetings in what we call the robing room, just a room just off of the court room before a hearing, out of the hearing of the child and the parent, but would invite in the participants from the agencies. I noticed that in juvenile justice cases, juvenile court cases, I was not inviting in CYS, and they were understandably upset and figuring that the purpose of the meeting in the robing room was to just criticize them. So it became clear to me that what I should do is invite them in. They were a valid part of the team, so that they would not feel left out. That's how strong the feeling is. That's how strong the feeling became that this should be a united effort. I do encourage everyone to read the SCR protocol that's been distributed. We worked very hard on that. We started with a draft that, in my view, was about 10 years old, that had a lot of passive voice and not many time deadlines. We worked hard to clarify exactly who was supposed to do what when. So it became much easier for me to take a look at that and say, where are you in this process, and who, if anybody, is dropping the ball? That was not easy to work through that process, but it was very productive. I would encourage anyone who's on this call who's interested to review that SCR protocol, as well as the memorandum of understanding and the universal releases. Coming up with the universal releases was a great idea in order to save time and effort for the parents, especially. You may come up with, if you read our protocol, you may come up with different answers, but at least use it as an issue spotting effort, so you can think through how you want to make your system work better.
So a couple of panelists have referenced the documents. They have been posted in the chat box at this point. 3 documents from Erie County and 3 documents from Delaware. These are their multi-systems integration protocols. There are memorandums of understanding that includes around information sharing, and those consent forms that the judge is referencing. So please download those, because I think the judge is correct that they might provide food for thought in terms of how you might approach this.
Okay, if I can just add one more thing. In terms of implementation, it's not surprising that it takes a little time to develop to get the system humming. I think we're doing a darn good job in setting up the meetings. And for the most part, everybody who needs to be invited to the meetings is invited, which includes the schools and behavioral health. But different people have different ways of scheduling the meetings and the timing of such meetings. So I think more often than we will ultimately we have absences from those meetings. And it's not clear to me that the parent and child are included as often as they could be. So we're working that out. I also think that as a judge, I can do more to, when I have hearings, to say, what did you come up with? What was the plan from the last meeting? And when is the next meeting? And are the parent and the child coming to those meetings, to try to help support this whole concept by working it into the court agenda?
I appreciate that comment, Judge Biswal. A lot of cases might be multi-systems that haven't come to court yet. There are a lot of cases that are in court. And in many ways, the judge is a point of accountability, where you're saying, have you done this in accordance with our protocols? Well, have you had the meetings you're supposed to have, and people shown up at those meetings? That's a great level of accountability that Melanie referenced earlier, that part of doing this created an accountability in terms of how you're doing the work. I want to turn to Erie County. So Gina, in terms of the benefits, I know you've just launched the protocols, but I think that as we've communicated with the Erie team over time, there's a number of benefits that you all have identified of being engaged in this pilot program. And I thought you might want to talk about some of those, as well as any initial benefits you're seeing in this very, very early launch of your protocols.
Sure. I think what Melanie said so eloquently, I wanted to echo some of the same things, but emphasize especially those kids or families knowing what to expect and having consistency is so important, especially because most of them have such trauma and crisis, and they're in that mode. So to be able to have this team assembled that they know they can go to and what to expect, what's next, is critical. And also too, I think improving the trust and the overall relationship with the JPO and OCY. I mean, let's face it, they have bad reputations. People don't want OCY and JPO at their door. So, getting to know these people and knowing that they care about the kids, they're invested in the family, is also huge. And also huge for the new staff. I see a lot of the younger caseworkers really not knowing the community services and how things are structured in other systems. To have a team for some of those unseasoned caseworkers is also a great thing. And I think what I'm most excited about is, in my years of direct service, 17 years, involving the school and mental health issues or anything like that was kind of frowned upon. Schools, you didn't tell the schools anything, and families don't want the schools to know if their kids in JPO or OCY either. So, but guess what? The kids though are at school most of the time, and for these kids, that's their safe place. And they might have a counselor there that they talk to or a favorite teacher. So for them to know that the school is also supporting this, and they can, the school trusts these people too. And in our city school system is so wonderful. Sherry and her team do such a great job. They know their kids. So having them on board is just, it's really, it's wonderful. So those are what I see right now.
Thanks, Gina.
Jay, I'd like to piggyback
Yeah,
off of what
I was
Gina
just gonna
just
say,
said.
she set you up, Sherry, because I was going to next about your perspective on seeing the benefits of this, but she was like handing you the softball.
Yeah, it is going to be so refreshing to have my frontline staff who work with the students every day, the support staff like my mental health specialists, guidance counselors, and behavior interventionists who have already built those relationships with those kids. And oftentimes we're sort of just that tier 1 support. And we are constantly sort of looking for additional tier 2 and tier 3 supports for our family and hoping to benefit from those agencies and servicing our students. And oftentimes we are the conduit, our connection to the family to get them connected with those supports and services, but also to help that family build that trust as we support their child in the school setting, that they also have those supports outside of the school setting.
That's great. One of the issues, Sherry, that comes up a lot when we do see a jurisdiction wanting to bring education to the table, and for Erie, this is really important because as we've looked at the baseline data, the pre-pilot data, about 80% of the kids that we're looking at might be in your city school district. So one of the barriers often is the Family Education Rights and Privacy Act is seen as a barrier to sharing information as opposed to the holy grail about when you can share information in an appropriate manner. I know you involved your legal counsel in making sure we worked through those issues in a well-informed way, that we did not violate the privacy interests of your students. Would you recommend that to others to make sure their legal counsel is at the table, but in a way to say, how can we make this happen in a way that makes it work?
I would absolutely recommend that your legal counsel participates in this. It was a long road, I think, for us with a lot of going back and forth, revising and editing what we will be sharing with agencies, whom we will be sharing that information to, and ensuring that the parents are well informed of what types of information we are going to be sharing with those agencies. So that was a lot of work and a lot of back and forth because I think all school districts hold FERPA information close to the chest, because our past practice, and Gina can attest to this, when they would request information, our first go-to, I was a building principal, was I'm calling my solicitor because I don't know if I could share this information with you, and for what reasons and what purposes. But there was also the flip side of that, whose students were receiving outside supports. We were dealing with that student in the school setting and had no information from them either. They didn't share their information around treatment plans or how we could support the student in the school as well. So that was a challenge, but I think we met that challenge and overcame it.
Well, I think in your MOU for Erie County, you really address those issues of what kind of information could be shared and what instances with whom, for what purposes and for how long.
Yep.
That really was a very thoughtful way of approaching that. So I know education sometimes is say this in no negative way to educators, I love them, but as a barrier as opposed to a facilitator. Because I think if you really engage in the correct way, it can be a facilitation of the kind of important information that can be shared in certain circumstances. Both of the counties have mentioned training, tangentially mentioned training. So I want you each just to spend a minute on how you organize the training, and then I want to turn to Delco for you to talk about your focus groups. and then we'll get onto the data. So I'm going to start with Gina. Could you briefly describe how you all set up the training for Erie County staff? So once you got through with developing all these protocols and the MOU and how they're to use the consent form, how did you actually conduct the training so people knew what they were supposed to do?
So we knew we wouldn't be able to do an in-person training because a lot of folks were still working remotely and schedules were just not allowing, because once we launched in the summertime and in the school folks were not in session, so they wouldn't be able to be part of the training. So Richard Gold and myself, worked with our cable access television station, and we created 3 videotaped modules. One was an introduction to MSI, and one was about the MOU, and the last was about the protocol. And we had our leaders from Department of Human Services, OCY, our medical director, Dr. Albaugh, and a family member. They were interviewed talk show style, and there were a PowerPoint for each one, and during that they were spliced through the PowerPoint interviews about the benefits of MSI and the barriers that they saw, and that modules are each, I think, 20 minutes long, so it's a total of 1 hour for all 3. And we launched those out to all of the OCY staff, all of the JPO staff, the school staff, and then our stakeholders, our provider groups, and our SAP liaisons. So it all went out via link, and folks could take the training when they had time, during their staff meetings. A lot of the folks did it that way, or in their downtime. Like I said, it was only an hour of their time. So that's how we felt we could best get that information out.
Great. Thanks.
And
Thank you.
Shay, I'd like to piggyback off of how the district did it, because
Sure.
we were out of session in the summer. I designated 2 hours of professional development on our in-service day, where I gathered my support staff. We all watched the videos together so that they had a clear understanding. And the second half of that was a review of all of the documents. What does the MOU say? What do the protocols say? A review of the consent form, so that they clearly understood, one, what the program was about and why we were doing this, but what their roles and expectations would be going forward when we work with our partners in this.
Yeah, that was a great idea to do that professional development time, because it's already set up, right? And you just are dedicating the topic, and this was an important, timely topic. Melanie, I know you spearheaded the training with Gretchen across the 2 systems. Can you guys describe how you set it up? And then also, if you can add into that your outreach to the schools, what you did in terms of having points of contact with the schools, not necessarily in relation to training per se, but how you identified people in the schools that would be a point of contact.
Sure. We had the decision we made on the outset was to have training with all of the systems together. So we ended up going with a virtual platform and having a mix of all 4 systems in each of the 4 trainings. So we had 4 identical half-day virtual sessions, and people in the county in all systems were asked to sign up for one of those sessions. So overall, we had about 230 people altogether, broken down into these total in all of the sessions. So we were able to reach that many people. Our agenda was a short overview of the multi-system project, and then each system, CYS, JPO, our Office of Mental Health, and all 3 of those did about a 15-minute overview of their system, kind of giving the basic flow and the basic jargon and things that anyone in the training who didn't know could get a basic idea of how the system functions. So education also talked a little bit about the importance of, like, a lot of what Sherry said. They let us know why they felt that this work was important and how they were appreciative to be a part of it. We then reviewed the protocols in each training session. We then moved along to talking about the benefits of the protocol. And then we had some breakout rooms, and each breakout room had a case scenario to work through and talk about, and come back to the group and report out what they identified in that case scenario as goals, next steps, strengths, weaknesses, protective factors. So it ended up being a mix of system people in each breakout room. So I think it went well. We recorded one of the sessions and have used it for future training. I know then I had small group sessions here in juvenile probation with, again, like Sherry said, how will this affect you specifically? What will your role be here? Under the protocols, the probation officers are facilitating the monthly meetings with the team. So it was important to make sure that they understood they were sending the invitation. They were identifying the appropriate parties. And, you know, we learned, I know that I think it was Gina mentioned having some staff who are a little on the newer side. They're still learning about the processes. So we recognized after a little bit of getting into this that we were asking the probation officers to facilitate team meetings, pretty important nature and topic. So we are having a team facilitation training for all the juvenile probation officers in January, just to teach the basic skills of facilitating a team meeting. So that was something I wish we would have done before the protocols started, but we recognized the need as we were putting them in place.
I think you invited child welfare to that training too, if I remember correctly.
Yes, so we actually had it scheduled for last month, but we had a hiccup and the trainer wasn't able to do it. But yes, I know that Gretchen was going to come so that she could consider bringing that over to her group as well, which now we'll just be extending the invitation come January. As far as the school districts, Shay, I know that 2 members of our leadership team had gone to a student or a superintendent's meeting. We have 15 school districts in Delaware County. So it's been a little challenging to get the information filtered to all of them. But I know that our deputy director and then the Office of Mental Health leader met with, I think they were invited to a superintendent's meeting. So they were able to explain and introduce the multi-systems project at that large group meeting. And then afterward, they tried to schedule, and I believe successfully scheduled with almost all of the school districts, the high schools or the district liaisons, individual meetings to talk more about the project. The point of contact list. So the Delaware County Intermediate Unit was able to identify the Act 1 points of contact for every school. So every school district is required to have a point of contact person for Act 1, which talks about reintegrating kids who are involved in dependency and delinquency into the school districts. So it seemed to fit that they would be the point of contact for kids involved in multi-systems. So probation officers and CYS workers, when developing, when getting to know clients and recognizing what school they go to, they're able to contact that point of contact for the school district, who then is able to identify maybe the guidance counselor or the social worker involved in the case and direct the probation officer or CYS worker to that person. The point of contact person on our list isn't always the one interacting directly with the child, but they are able to get us to the right person.
And that's just been a critically important dimension to what you've set up.
Yes.
Okay.
So I would ask Gretchen if I forgot anything training wise, because I'm sure I did.
Well, we are running short on time, so I want the 2 of you to highlight in the next slides the focus groups that you've conducted. I think they were a brilliant way of midstream understanding how this work was being perceived and received by your staff.
Sure, I can talk about that a little bit, because I think it was my idea and Melanie came along for the ride. But I mean, I've been doing policy and protocol in our agency for a really long time, and we've always had casework level input. And actually in this implementation group, we didn't really. They certainly were part of the training. And I just felt like it was really important as we were collecting data to also hear kind of boots on the ground, like how is it really going, so we could tweak it moving forward. So we both picked, I think, 5 caseworkers, 5 JPOs to come together for a focus group, not supervisors, but the actual caseworkers and JPO officers who were doing the work, thinking that we would get maybe like 3 of each. And I think that's kind of what it came out to. We might have had maybe 4 JPO and 3 CYS. workers, but they really gave some really valuable feedback. And positively, they feel like the protocols are working, that they are having these meaningful meetings, especially with youth and family when they're participating, for these more complex cases, having scheduled meetings where we're working through the goals has been really helpful for them. I do think that they want more of the youth and family involvement. So we were kind of brainstorming some of the ideas where we could enhance that a little bit more, maybe get more families and kids to participate. For us, we started these protocols in, I think, April of 2023. And so school was kind of winding down. So they're seeing schools on board with some of these meetings now as the school year is starting, but we want to kind of monitor that a little bit and make sure we're continuing to pull in the school districts with that. On the other side of things that they said, they thought could be tweaked a little bit, really had to do around JPO has a whole script that they go through. And I think kind of what Melanie said, some just naturally know how to facilitate a meeting and others are very like just going through the script. So I think sometimes it's a little bit more robotic than other meetings, but I think that's just in general, just learning how to do it. And then just really quickly, some of the lower level cases, like if they're doing courtesy supervision, those meetings, to have them every month where there's just not a lot to talk about, they thought maybe it was a little bit overkill having the monthly meetings for those. Or some of our kids who are in JPO placement, until we're getting ready to kind of move forward with a discharge plan, I think sometimes they're feeling like those meetings are the same thing all the time. So Melanie and I think we both took that in of like, okay, how can, especially the kids in placement, because I think there's a lot to talk about there, that maybe we just need to help them kind of create what that is a little bit better. So I don't know, Melanie, if there's anything you want to capture there.
No, I think you got it. Thank you.
Can you move to the next slide?
Sure.
Anything here that you want to comment on?
Yeah, these also came from the focus group. This was some more takeaways from the focus group. So the probation officers did feel as though the participation with probation, CYS, and programs that the kid is participating in, community-based programs, either referred by probation or referred by CYS, that there had been consistent participation with them. School participation, as Gretchen said, has recently increased. If there's a lot going on at school, the school usually has been attending. Is there a next slide? Yeah, there we go. So Gretchen went through this. Some staff feel that the team meetings are too scripted. Yes, this is exactly what Gretchen went through. So a couple of the focus group participants did not have a clear recollection of attending the trainings. So as the trainers, of course, we couldn't believe it, but it was not the riveting experience that we thought it was. So I think that I in hindsight wouldn't do it virtually, to be quite honest, but just other ways to make the training more meaningful moving forward might include smaller group sessions and boosters.
And I just, to those in the audience, think about starting a project like this. I think if you're whatever level and you're proposing to leadership to engage in this type of work, we'd be more than happy to share how to launch this type of effort. But having this ability to take a midstream look with staff as how they're experiencing it, may be a very different conversation compared to leadership talking about how it's going so far. So the coming together around this really has been phenomenal. Okay, I'm going to move on around the data at this point and turn it over to Dr. Ogle to talk about the data type. And you can see it here. Here's the data overview, and I'm going to turn it over to Meg.
Thank you. In the interest of time, I'm really just going to be focusing on the types of data and the data analysis plan, but the slides will be provided so you can take a look at more of the specifics of the types of data we'll be collecting on your own time. Next slide. So there were three main types of data that we collected for this project. The first is the baseline data, and this data was systems population data. So it's really just to get an overview of what each of the populations of the different systems looked like prior to any changes being made. We chose calendar year 2018 and school year 2018-19 because of the COVID-19 pandemic, and we wanted to get a picture of these systems before any of the data was skewed by the pandemic. The second type of data that we collected is pre-pilot data. So in Erie County, pre-pilot data referred to youth that were simultaneously served by all four systems: behavioral health, child welfare, juvenile probation, and education. And they entered the last of those four systems during either 2017 or 2018. In Delaware County, the protocols are going to be applied to crossover cases as well as multi-system involved cases. So the multi-system involved cases are those that are simultaneously involved in all four systems. In Delaware County, they define the crossover cases as having simultaneous involvement in juvenile probation, child welfare, and education. So the pre-pilot data in Delaware County consisted of youth simultaneously served by either 3 or 4 systems during 2018. For the pre-pilot data, we will be following all of the youth identified as pre-pilot youth for 9 months to determine what changes were made within those 9 months. Either for the pre-pilot data, it would be for the old ways of care. And then with the pilot data, we'll be able to look at the new protocols being in place as well. So I just wanted to give an example of what exactly a multi-system involved case might look like. It gets a little dicey when you say youth involved simultaneously in all 4 systems. So at the bottom, that really long bar, for every youth in this study, we included education involvement as a given. All of the youth included in the study were ages 10 to 17, so they should all be enrolled in school. If you move up to the second bar, you can see that in this hypothetical case, a youth entered behavioral health system at the beginning of their career trajectory that we're looking at here. A little later on, you can see the next bar up that the youth entered the child welfare system. Now, importantly, at the same time, the youth is still receiving services from behavioral health and still enrolled in school. And when we get to about the middle of the slide at that blue line, we could see that the youth was referred to the juvenile justice system. At this point in time, the youth would become a multi-system involved case or an MSI case. The date that the youth was referred to the juvenile justice system, since that was the last of the 4 systems entered, would be the multi-systems identification date. So the 9-month follow-up measures that we are tracking are 9 months following this multi-systems identification date. Next slide. The third type of data that we're beginning to collect is pilot data. So in Erie County, the pilot data will consist of youth simultaneously served by all 4 systems on or after implementation of the new protocols. In Delaware County, the new protocols were implemented on April 3rd, 2023. So the pilot data consists of youth that were simultaneously served by either 3 systems, the crossover youth, or 4 systems on or after April 3rd of this year. Next slide. Moving on to the data analysis plan. So the data analysis plan is pretty similar, but looks a little different for each of the counties. So for Erie County, on the left-hand side of the screen, the pre-pilot MSI cases will be youth simultaneously served by all 4 systems who entered that final system. Their MSI identification date was in 2017 or 2018. These pre-pilot cases will be compared to 2 different groups of pilot cases, which you can see on the right side of the screen. So on the top right-hand side of the screen, we can see the new pilot MSI cases. So these are youth simultaneously served by all 4 systems, where that MSI identification date occurred after the implementation of the new protocols. This group of youth only received the new protocols. The bottom set of existing pilot cases were youth simultaneously served by all 4 systems prior to implementing the new protocols, but continuing to be served by all 4 systems after the new protocols were in place. So that bottom group of existing pilot cases would have received both the business as usual before the new protocols were developed and the new protocols as well. Next slide. The data analysis plan for Delaware County, again, looks pretty similar. So on the left-hand side, we can see the pre-pilot MSI cases would be youth simultaneously served by all 4 systems during 2018. That white line in the middle, the new protocols were implemented on April 3rd. So that's our dividing line between the pre and post-pilot cases. And similar to the Erie County on the top, we see the new pilot cases. So youth who their MSI date was April 3rd or later, they received only the new protocols, and the existing pilot cases would be youth who their MSI identification date was before April 3rd, but they were continuing to be served by all 4 systems afterwards. So they received both the new and old protocols. And this structure, if you hit one more advance, this structure is mirrored with the crossover cases in Delaware County. So these, again, are youth simultaneously involved in juvenile probation, child welfare, and education. Next slide. These next few slides give an overview of some of the baseline data that we'll be reviewing. Again, you can look through these at your leisure. So if you could advance. And again, and just one more time. So the pre-pilot data so far in both counties, we've identified 51 pre-pilot youth. The most important data point, at least in my opinion, that we'll be looking at is examining the most common pathway to multi-system involvement, something that Shay mentioned earlier. We want to know the typical order that a youth would follow before becoming multi-system involved so that we can move upstream and try to prevent more multi-system cases from occurring. And that's just an example of a few of the data elements that we'll be collecting, but you can peruse those on your own time. Next. I did want to stop here and highlight the Delaware County Data Work Group did send over a few of their observations from collecting the baseline and pre-pilot data, and I thought these are really important to share for any jurisdictions that want to take on this work. The first was that over-communication is key. So the Data Work Group set up a Teams channel to share both documents and to communicate with one another, and that in addition to the data work group meetings that occur intermittently between those monthly meetings has been trying but helpful, trying to fit in everyone's schedules, but helpful in that communication has been key. The second observation was that it's been really difficult seeking historical data, especially given expungements, archived information, and a lack of consent at the time that the data was being collected. But most challenging for the data work group has been the education data pieces. Several of the school districts in Delaware County have been difficult to reach and partner with. As Melanie mentioned earlier, there are 15, so it's not quite the same as Erie County, where they have one major school district that's 80% of the MSI kids. They're a little bit more spread out in Delaware County. So bringing everyone to the table and getting that historical data from them has been difficult. And finally, the last observation they wanted to share was that allocating time and resources for data collection, entry, and analysis is critical. However, this is very challenging given staffing shortages and the competing demands. Everyone on the data work group has a caseload and is working with youth every day, so carving out the time to collect and analyze the data, although they recognize that its importance, it is something that's challenging and needs to be budgeted for if you're going to take on this work. Next slide, please. And I do want to give just a sneak peek of the pilot data thus far. So we're about 6 months into Delaware County's launch of the new protocols. They have identified thus far 41 pilot youth, 30 of which are multi-system involved and 11 of which are crossover, so that 3-system involvement. Delaware County is also working very diligently to collect data on those monthly team meetings that are occurring that were mentioned earlier. And I want to actually turn it over to Melanie Govan right now. She's been really spearheading the collection on that data.
Thanks, Meg. I actually, what you're looking at here is the first 5 months. What I had done was taken a look at all the MSI meetings that occurred, and I just identified how many meetings had representation from each system or each provider. So here we have the child welfare system and then the youth and the parent participation. So the first 5 months, we had the CYS worker at 93% of the meetings. And then we've moved on to the past month. You can see we've had the CYS worker at all of the meetings. The youth and the parent are really important, and we're working to try and learn how to better motivate them to come to the hearings. I think Judge Lowe had said, we have to look closely at whether they're being invited. Are they being invited timely? The good news is these meetings that we have monthly with the team are held in person or virtual or hybrid. So the family is offered any way that works better for them. So in the first 5 months, at looking at all of the meetings, we had the kids attending about 26% of the meetings. The parent attending about 23%. So we're creeping up. Over the past month, that's increased a little. The kids have participated in about 32% of their meetings, and the parent and guardian have participated in about 27%. So like I said, at this point, I just had pulled the meetings and identified who was there and who wasn't there. Moving forward, we are adding a measure to identify when invitations are sent and who was invited. So we'll be able to, we've like a formal way to track not only who was there, but backtracking to when was everyone invited and who all were invited. So that's something I wish we would have been looking at from the beginning, but moving forward, that's what we'll be looking at.
One question, just to be clear, this is the new monthly meeting that you've developed under your protocols. It
Yes.
basically didn't exist in this form before, where parents and young people wouldn't have been at the meeting. It would have been, if anything, just a professional staff meeting. This
Correct.
is,
And that's the major change for us from the SCR procedures to the protocols. There were several little things, but worth mentioning is we had required monthly contact between the probation officer and the CYS worker before these protocols went into place. They had to talk monthly. It could be an email, it could be exchange voice messages, it could be I saw you in the hallway and gave you an update. The biggest difference the protocols put forth for us was having a team meeting where the family and the juvenile are invited. So we're inviting the juvenile family, but we're also inviting any mental health treatment providers, the school guidance counselor or social worker. We're inviting the guardian ad litem, the CASA worker, the defense attorney. So anyone the child wants to bring who feels is a support person for them. So that's the biggest piece of, that's the newest thing under the protocols for us. So yes, when I'm tracking the meetings, I'm talking about the meetings that are new under the protocols.
and this is in addition to an individual intake meeting that a JPO might have, where they're reaching out to create input from other systems or involvement. Same thing, Gretchen, on
Yes.
your side, where you might be holding one of your regular meetings with the family, where you might invite the JPO to be part of that meeting under your protocols as well. So I want to make sure the audience understands this is a data run just on the monthly meetings, not on
Yes.
the other dimensions of the protocols where there might be teaming going on. Okay.
Correct. And no one's limited to just the monthly meetings. Obviously, the professionals may have to talk outside the meetings.
So I want to close out just real quickly. If you had to give one piece of advice to a member in the audience who's sitting at a county level, state level, what would it be in terms of how to advance this work if they wanted to in their own jurisdiction? And I'll start with Judge Lowe. You got literally this is like a speed date, Judge. You got like 30 seconds.
I'll address this to the judges. You should assume that you're going to be on the hot seat. You're going to have a hearing where there'll be 15 people there who have met, have no answers. There's no place to put the kid. They have behavioral problems, so they can't be in a foster care placement. And they have all kinds of mental health issues, which makes it hard to put them in any kind of a juvenile placement. Do what you can. Start with what you have. Do what you can. Do your best.
Melanie?
I would say have trainings in person, have small group, maybe train. I think it's underestimating the training. Like I said, we're now scheduling how to facilitate a meeting training. So I think seeing the training needs from the front in hindsight, I would have tried to strengthen training on the things I believed were basic.
Gretchen, thank you.
I do think having judicial oversight of what we were doing is huge. That was not part of our protocol before. It was just JPO and CYS trying to work it out. And then the judge was like, I don't even know what you're talking about with shared, like they had no idea. So having the judge be a part of enhancing the protocols that we already had, I think has made a huge difference in everybody understanding the same language and communicating around this project.
I appreciate that, Gretchen. And Judge, I know there was a question asked in the Q&A box about whether this should be codified in some way and adopted by the National Council of Juvenile and Family Court Judges. And we can probably take a look at that later because we're out of time, but I think it's a wonderful idea. Sherry?
The answer is yes.
Okay. Sherry.
I think as an educational entity, really knowing how the other entities work and function, what their processes are, and understanding that so that you know how you fit in and how you can support that work.
Great. Thank you, Sherry. And last but by no means least, Gina.
I would say, taking the time to put the mirror up and take a look where you're at in the moment and see where your weaknesses are, and most importantly, your strengths, and really try to focus on those strengths.
Yeah, kind of like what we try to do with the gap analysis. I know that happened before you signed on, but that's what that was really designed to do with the rubric. Anybody who's interested in that rubric, we can always provide it as a resource. There was one other question in the question box about youth and family engagement involved in the case management process. I think we've answered that to some degree, but does anybody want to take a shot at how this whole effort has been really designed to focus more on a family and youth-centered process? Anybody can jump in on this one.
I'll do that. I think it's great if the child and the parent are involved, and hopefully the team will be better informed with how to proceed by getting feedback from the child and the parent. On the other hand, we require so much of them already. There has to be some kind of delicate balance.
Thank you. And thank you all panelists. Meg, thanks for joining in. You all have been phenomenal to work with. Thanks again to Stoneleigh and to Georgetown for their support of this work. This is the second of a 3-part series. The third webinar will occur at the end of the project, which would be next fall, where we will have a final report on exactly what these 2 counties accomplished. We'll have more definitive data on what the outcomes were, comparing baseline to pre-pilot to pilot. But as you can see, it's a very rich and robust data set that we're looking in terms of a data template. And with Dr. Ogle's help and the 2 great data work groups in the 2 counties, we'll have some really good findings, I think, to show what we were able to accomplish. So with that, Mark, I think we're ready to sign off, and thank everybody for participating.
Thank you.